My slides and presentation mode?
No, actually, yeah, that's
They're here? Okay, great. All right. Thank you so much. Thank you so much for that introduction. I want to thank everyone for spending part of your day with me, and I'm excited to share with you some of my thoughts on heat, climate change, and human health. This is my contact information, so please feel free to email me with any questions, and also I'm glad to share my slides with anyone who's interested. So we know that there's a growing problem of heat and heat waves under a changing climate, with higher average temperatures, higher number of heat waves, and so on across the world. But I thought it would be useful to talk about some specifics of how climate change is going to impact our world. So there are many different ways that climate change is going to affect us. We can look at agriculture with changes in crop yields and irrigation, changes in the forest composition, changes in ecological zones for different species, issues of water supply and water quality, issues in coastal areas in particular, like beach erosion, saltwater intrusion, and so on. And then in relatively recent years in climate change science, there's more work on the impact on human health. Most of this work is looking at what we would call direct impacts, so things like weather-related illness, like heat waves, infectious disease, and air quality impacts, like increased levels of tropospheric ozone. However, I argue that all of these different climate change impacts are actually going to be impacting human health. So just take some examples. These changes in agriculture could be affecting nutritional status. Changes in water supply could affect sanitation and also could affect things like environmental refugees, environmental displacement, and even conflict. So I personally believe that the estimates of the health impacts of climate change are drastically underestimates because they tend to be missing the many, many different ways in which climate change is impacting human health. Now, looking at the health part of climate change is actually relatively recent in terms of climate change science. This is a figure I update every year on the number of articles that have climate change and health in their title abstract in PubMed. And you can see this just incredible rise in the number of articles. And I always tell my students that when I was in PhD school, I read all the articles on climate change and health. I read every report I could find, I read every journal article, and now it would be much more difficult to do because we have so much more. So we have this incredible growth of scientific evidence on climate and health and of interest on climate change and health. Now, what this graph doesn't show us is, well, what did all these papers find? But we know from IPCC, the Intergovernmental Panel on Climate Change, and we know from review articles that this scientific literature overwhelmingly shows that climate change is anticipated to have a high negative burden on public health. One of the ways this is going to happen is happening is through heat waves. And I just want to take a minute to talk about the definition of a heat wave, which is something that often gets looked over. So a heat wave, of course, we all know it's an extended period of extreme heat, but I think it's important to note that there is no standard definition of a heat wave, not in science, not in policy. And definitions typically look at duration. So you must have two or more consecutive days of high heat, or you must have three or more consecutive days of high heat, and so on. And then they also typically define a threshold, like you must have temperatures above the 97th percentile for that city. And this can be defined in different ways. Like, do I mean the average across the heat wave days, or do I mean each individual heat wave day? But this is important because it means when you look at things like policy, like heat wave action plans, heat wave warning systems across different cities, or you look at the scientific literature across different studies, people could be defining heat waves in slightly different ways. So I think it's important to keep that in mind. And we know that heat waves are increasing. So this shows, this is for the United States, showing the duration of heat waves and the frequency of heat waves. So heat waves are lasting longer, they are occurring more often, they are burning hotter, and they're occurring earlier in the year. And so we can anticipate an increased health burden from heat waves under a changing climate. I just want to show some more examples of how heat is functioning spatially. And so I've pulled some figures from a few different studies, and I'm using Chile as an example. So this is a study. This is not my study, but I think it's a really nice paper that looks at how heat waves have changed in Chile since the 1980s. And they used a variety of different data sources and methodologies, but the middle figure there shows the increase in heat waves by decade for this area. And so you can see several things. One is there's a growing number of heat waves, on average 2 to more heat waves per decade, but you also see different spatial variation. So it's not that everything is being raised at the same level. Some places are being hit harder than others. And this is another paper, again, not from my group, but a paper I like that is really trying to look at a community level, what's happening for heat waves. And this is for Santiago. So they used a variety of data sets. They used satellite imagery, monitor measurements, regression modeling, a lot of different data sets to estimate the urban heat island effect. And the figures I've pulled from the paper for you on the top row show daytime urban heat island, and the bottom show nighttime urban heat island. So several things I want to point out from these figures. One is these patterns of day and night are different. They're related, but they're different. And this matters because your body has a different physiological response to what's happening to high daytime temperatures and high nighttime temperatures. And obviously, activity patterns are typically quite different. And the second point I want to make is we see enormous spatial variation. So this means that even within a city, there's huge variation with hotspots of heat where some communities are going to have higher exposure than others. And this leads me to this third paper I want to share, also a paper I like, not from my group, where they're trying to layer different types of information here for Santiago. So what you see in figure A is exposure. Those are looking at places with high heat. But what you see in figure B in the upper right are where populations live that the authors considered particularly at risk. So they're looking at people who are older populations, the very young, disabled populations, and then low socioeconomic position populations. And you see those patterns are actually quite different. I think this is really important because a lot of studies on heat or on environmental exposures in general often will focus on one aspect of vulnerability. So for example, they talk about where is the exposure highest. That's map A. Or they talk about populations that we expect to have a high health response to exposure. That's map B. Both of these are actually really important because our health is affected by complex systems of socioeconomics, healthcare, behavior, variety of different demographics, and exposure. So we have multiple layers of what's happening for who's truly at risk. So you could be in an area that has low exposure comparatively, but you might be at particular risk due to having low baseline health status, and you're still at risk, even though you might not show up on map A. So the next point I want to make is to talk about the health impacts from this heat. And I want to talk about extreme heat, but also mention that cold matters and what we call non-optimal temperature matters, which I'll describe more in a minute. And here I'm going to start sharing some kind of research vignettes from our own research team. And the first one I want to share with you is a paper we did some time ago looking at how heat impacts mortality in 3 Latin American cities. We looked at Santiago, São Paulo, and Mexico City. So this is showing you the mortality rate, odds ratio for different temperatures. And a few things I want to point out from this is that you'll notice that it's this kind of U-shaped nonlinear relationship typically happening, not always. So temperature is a very strange environmental exposure in terms of environmental health because for most environmental exposures, like water pollution or air pollution, the higher the level of exposure, the higher the health response. Temperature is different. You have high risk at high exposures, but you also have high risk at low exposures. Second thing I want to point out is that the cities are somewhat different, right? The Sao Paulo figure does not look like the Mexico City figure. So why would this be? So we see differences across cities throughout the world and even within the same country due to differences in population, healthcare, occupation, housing structure, and a variety of different factors. This highlights the importance of having locally derived understanding of how heat is impacting a community. We can't assume that the relationship between heat and health in one city is perfectly generalizable to another city. Now, this work is similar, but showing you some cities in India. We looked at 5 cities. Two of the cities were close together and similar, so we clustered them. And this work was led by my former PhD student, Amruta Nori Sarma. So here again, we see this pattern of this U shape. Again, we see this pattern of the effects are different across different cities. But I want to point out that we still see a cold effect in some locations. Like look at the bottom row, even though it's really not very cold there. In fact, it's more likely to get very hot. So I have a photo here showing you pavement melting. When I first saw this, I thought it was photoshopped. It's not. There are cases where it has been so hot in India that the pavement has literally melted. So what we see is that another thing that's interesting and different about weather and health is that the highest impacts are not necessarily the
Uy,
places with the highest
no,
exposure. So what I mean by that is that you can have an impact to heat if it's hot for your area, and you can have an impact for cold if it's cold for your area, even if it's not very cold. So for example, in the United States, the highest heat impacts or the heat impacts in the Northeast are higher than in the Southeast, even though it's much hotter in the Southeast. So it's again emphasizing the need for a localized understanding, even across cities in the same country. But we know that these heat impacts are impacting different subpopulations in different ways. So this is work we did looking at cardiovascular and respiratory disease in relation to heat waves in Rio de Janeiro, and this work was led by Dr. Silveira. And we did an analysis of over 42,000 participants with cardiovascular disease and over 29,000 with respiratory disease. And a big strength of this study is we have individual geocoded addresses, so we know exactly where each of these participants lived. This helps us get really good estimates of their exposure to heat. So some other studies use kind of a citywide exposure, which is still a very useful, reasonable way to do analysis. But here we're able to go at a much more granular level. And we looked at different types of defining heat waves. We looked at different thresholds. So this is a table of our results, and I'm going to highlight certain things from this for you. Here I'm showing you cardiovascular. We also have this for respiratory. So let me just first highlight our kind of overall results. So this is saying that the risk of cardiovascular mortality on a heat wave day is statistically higher than a non-heat wave day. So for example, using the 90th percentile, it's 26% higher. You also see, as I define heat waves to be more stringent, to be hotter, that effect estimate goes up. And this makes sense because a heat wave that's exceeding the 99th percentile temperature we would anticipate would be more harmful than a heat wave exceeding the 90th percentile temperature. You may also notice that I lose statistical significance at those extreme heat wave definitions, and that's because those occur less often. But we are seeing a very clear relationship between cardiovascular mortality and heat waves in Rio de Janeiro. But we also want to look at differences by population. So here I've blown out the age analysis. So we're looking at populations 65 and older, and then the younger populations. And we see that the risks, they're not statistically higher, so there's some uncertainty, but they are generally higher for the older populations. And this makes sense as well because they are at lower baseline health status. You also see, again, I start to lose some statistical significance when I go into those higher effect estimates. But we can also look at differences like men versus women. And here, again, while there is overlap, we see suggestive evidence that men have lower risks than women.
Interior, né, Centro-Oeste.
And then
Tem aqui no Goiás, tem professor.
We also can look at intersectionality of different types of vulnerability. So for example, or age in relation to sex in this case. So what we are finding here is evidence for higher risk of cardiovascular mortality under heat wave conditions in Rio de Janeiro. I didn't show the results for respiratory because of time, but we also found effects for respiratory mortality. But we also found that evidence that suggests that some populations are more at risk than others. For this particular work, We found risks for older populations compared to younger populations and for women compared to men. This is really important because it means that when you have a heat wave response or a heat action plan, you could pay particular attention to the groups that are at the highest risks. So why don't we just have a heat wave warning system? Tell people when a heat wave is happening, and then they can protect themselves. And this does happen, and it's a really very useful system, but there are also some important trade-offs for this as well that I want to highlight. So now I want to share with you some work we did analyzing heat wave action plans. And this is work led by Seolki Ho, who's a research scientist in our group. So here we're looking at South Korea for the entire country, and we want to look at how mortality is different when you have a heat wave warning than when you don't. So I just want to highlight this section right here. So you can imagine taking every day and putting it into one of four categories. These days in green are days where the warning system got it right. The upper left, you have a heat wave alert, and it turns out it really was a heat wave. And then in the bottom right, you did not have a heat wave alert on that day, and it wasn't a heat wave. So the heat wave warning system predicted perfectly correctly. But it's a prediction. It's not always going to get it right. So here in the blue on the top row, a heat wave warning was issued, but then when the day happened and we have the meteorological data, it turns out it really wasn't a heat wave. And then in blue, you have the opposite problem. You did not issue an alert, but turns out it was a heat wave. Now, this is in no way intended to be a criticism of the heat wave warning system because they're predictions. They can't be perfect, can't always get it right. And also, I want to point out that typically when it's off, it's close. So taking the top row, a heat wave alert was issued. It was not a heat wave day, but it was probably still a very warm day. And we saw in that nonlinear response where you have higher risk at higher heat, the health impacts are not just at the extremes. They're also at this non-optimal temperature, so you still have health impacts on warm days as well. So we found that most of the time, the heat wave warning system was correct in its predictions, about 81% of the time. So about 17.5% of the days, they issued a heat wave warning, and it was a heat wave. 63.4% of the days, they did not issue a heat wave warning, and they were correct. It was not a heat wave. But 13% of the days, they had a false positive. They issued a heat wave warning, but there wasn't one, although it was still probably a warm day. And then 6% of the time, they did not issue a heat wave warning, but turns out there really was. Now, this is the first trade-off I want to mention, is when we're designing a heat wave warning system is, would you rather have false positives or false negatives? Here they have more false positives because you're not going to always get it right. So you have a choice to make. Would I rather issue a heat wave warning when it's not a heat wave, or would I rather go the other way? And we also found, looking at the figure on the right, that the frequency in which they got it right or the prediction was off really varied by month. It was in the midsummer that the heat wave warnings did not match as well with the actual conditions. So we can either get it right or we can get it wrong, but we have a trade-off to make in terms of what we want for false positives and false negatives. Now here we can look at the mortality rates for those four different conditions. So I'll walk you through this figure. So this point I have circled in pink here, this is a red dot. So it is an actual heat wave day, but there was not an alert. So this is the highest risk day. Down here, we have the lowest risk day. It's not a heat wave day, but there was an alert. So even though it's not a heat wave day, a heat wave alert was issued. It was still probably a warm day. And so people took protections. And so you actually have benefit from the heat wave warning system, even on days when they get it wrong. If they say there's a heat wave effect, they have a false positive. They say there's a heat wave and it doesn't actually happen. All right, and so then we can look at these different counterfactuals, and in this work, we're trying to estimate the mortality benefits from heat wave warning systems. But I want to highlight a second trade-off. If you define your heat wave warning system to be very strict, so it has to be a very extreme heat wave, let's say 99th percentile and higher, you'll have very few heat warning days. And so you will miss the public health benefit of a heat wave warning system on less stringent heat wave days. places that are days that are still hot, but maybe not as hot. However, if you go the other way and say, I want to include a lot of heat wave days, so I'm going to make my heat wave warning system, let's say, 85% and higher, you will have a lot more heat wave warning days, but there's something that happens in the population that I call heat wave warning fatigue, which is that if there are a lot of warnings, people stop responding to them. So it's just human nature. If you have 2 heat wave warnings a season, you're going to respond very differently than if you have 2 a week. So there's also a trade-off in terms of how the population is going to respond. And I think this is also something where local relevant understanding of the population makes sense in terms of how people are going to respond. You don't want to have such an inclusive heat wave warning system that people basically ignore it. And so I've talked about how we have different heat health relationships by population, but we also can have differences by location, which I mentioned. But there are other ways in which this relationship can differ too. And I want to just highlight a few issues. One is urbanicity, rurality, and the other is green space. And this all relates to how populations respond differently to heat. So even if everybody had the exact same level of heat, they would respond differently. Now we know people don't all have the same level of heat. So there's actually different ways that you can have disparities in the health response to heat. And so these different health impacts for different populations is an environmental justice issue. So you can have differences in exposure. Who is exposed to higher levels of heat? And that was one of those maps that I showed you for earlier in the talk. You can have a different health response to heat. So we're all exposed to the same level of heat, but some people, like older populations, have a higher health response. There also can be additional inequities, procedural inequities. Using our heat and health context, are there situations where the heat wave warning system reaches some populations better than others? And is that an equity issue? And we know that there are different subpopulations that matter. And so for environmental health more broadly, we know there are higher health burdens for racial ethnic minority populations, people with low socioeconomic position, and basically any marginalized population, immigrants, LGBTQ+, rural populations, persons with disabilities, and so on. And then, of course, there's intersectionality. So what if a person is an immigrant and a racial ethnic minority population and has low socioeconomic status? Then they're at even higher risk. Another important thing to mention is both the individual and community level matter. So just as an example, people have lower health risk when they have low socioeconomic status as an individual, but also when they live in a community with low socioeconomic status. So there's so many different layers to how these disparities matter. And so those are talking about the populations. And here I want to get back to those 2 examples of green space and urbanicity. And I'll start with urbanicity because these are differences by place. So this is work led by my former PhD student, Hyun Choi. And here we're looking at the state of North Carolina in the United States, looking at how heat impacts mortality. And we see again this nonlinear relationship that we've seen many times before. But the different colored bands, I know they overlap, but they are indicating that you have higher risk for certain areas. So the red band is the most urban communities, and the kind of purplish band are the most rural communities. So what we see here is that everyone is at risk for heat and cold, but the urban areas are at particular risk. Now again, this varies by location. This is similar work led by my former postdoc Won-hee Lee, looking at the country of South Korea. And here we're also looking at the relationship between heat and mortality across different degrees of urbanicity. So let's just look at this part of the figure. These are just our urban areas. As we go from low urbanicity to higher urbanicity, in general, the heat risk increases. So within urban areas, the more urban areas are at higher risk than the lower urban areas. But we also have something quite different happening for rural areas. Within rural areas, the more rural we get, the higher the heat risk. And in fact, the highest risk population for heat in terms of urbanicity in South Korea are the very, very rural. And so why would we see such differences between urban and rural? Well, there's different activity patterns, different housing structure, depending on the location, different socioeconomic status, huge differences in access to health care, especially specialists, medical specialists. There also could be different housing structure, who's spending more time outside in occupation, so many differences. But we have this huge urban-rural divide that is different by country in terms of how it's related to heat. I think this is really important because we have this trend of climate change, but we also have a trend of urbanization, where the world is becoming more and more urban. And this rapid, unprecedented urbanization is actually changing rural areas as well. I mean, cities don't produce their own food. So we really, I think, need more understanding of the urban-rural differences in heat and health. And this brings up an issue of, well, what do you even mean by urban? And one of the things that's interesting in the field of environmental health is there is no standard way to define urbanicity. And in fact, different disciplines will define it differently. A very common metric that is used is population density. And this is a really useful and reasonable metric. But my point here that I want to make is that there's a lot going on with differences between urbanicity and rurality. And you can imagine two communities that have identical population density, but one is a suburb of a major city and one is out in a rural area. Those are radically different areas, but in our analysis of population density, they would be the same. So this is some work led by my postdoc, Iman Sung, and he's looking at different ways to define urbanicity and rurality. And the maps shown here are for the states of West Virginia and Virginia in the United States. And so there's many different aspects of urbanicity and rurality. And our goal here is definitely not to find the best or the right metric, but rather to highlight that different ways of looking at urbanicity and rurality are capturing different aspects of the urban-rural divide. And here we're comparing two different metrics. So on the left, we're comparing total population and nighttime lights, and on the right, we're comparing total population and road density. And so just taking on the left, looking at that top purple bands, those are showing the communities that under total population are classified as very urban, but under nighttime lights, some of them are classified as highly urban, and some of them are even classified as rural. And you could look at it for any band. So looking at the graph on the right, looking at the bottom, the kind of orangey red color, using total population, those communities that are classified as very rural, some of them are even classified as very urban under road density. So these urban rural metrics, they are highly correlated, but they are not perfectly correlated. And as we learn that urban and rural areas have different responses to heat and different urban rural patterns across different parts of the world, I think we should think carefully about what do we mean by urban and rural and which aspects of urban and rural are really important. So next I want to move to green space, and this is work led by my former PhD student, Ha-Yun Choi. And here we're looking at the relationship between heat and mortality and seeing if this relationship is higher or lower in cities based on their level of green space. So this is a global study where we had over 450 cities from over 24 countries. We have in-country collaborators for every country. And I show this map to highlight just the incredible number of cities and global scope of this work, but also to highlight the limitation of there's huge parts of the globe that are not in this analysis. So even though we see a lot of these large multi-city studies across the world, sorry, my cat knocked something over. We have large portions of the globe that are not included. And so the cities you see in the kind of purpley blue dark color, those are cities, they have a lot of green space and they have high temperature. And then the cities that are in the gray have low green space and low temperature. So this is basically what we're looking at. And so what we see here, comparing the 99th percentile of warm season temperature to the minimum mortality temperature for that city. So we're looking at whether or not it's hot in that city. And the minimum mortality temperature is the bottom of that curve. It is the curve with the lowest mortality impact. And what we see here is that we see risks for heat, but we see different risks depending on how green the city is. So let's just take total mortality. We see that the highest risk are for the low green space cities. And as we move to high green space cities, there's still a risk, but it gets lower. And then we see this for other causes as well, for cardiovascular and for respiratory. And so this is really impactful because green space is something that a city can do to increase its resilience in a changing climate. And there are other benefits of green space as well. I mean, green space can have positive and negative consequences, but overall, there are a lot of benefits, such as improved social cohesion, depending on the type of green space, improved mental health and well-being, improved air pollution, lowering the urban heat line effect, and so on. So this is an example of some resilience that we could see for cities. Right. So I've talked a lot about different health outcomes for mortality. You may have seen many studies for hospital admissions, but I really want to make the point here that I believe that our estimates of climate change and health, including heat and health, are very much underestimates of the public health burden. Excuse me. And so I want to highlight some work that we've done looking at other understudied health impacts. And I want to start with crime. So this is work by Seolki Ho, a research scientist in our group, looking at violent crime in South Korea in relation to heat. So what you see here in the red are temperature patterns, and you see what we would expect, a very seasonal temperature pattern. And then blue are crimes, which also have a seasonal pattern. Crime follows a very similar pattern to heat. So we have conducted a variety of studies. The one I'm showing you here is for South Korea, looking at does day-to-day variation in temperature relate to day-to-day variation in crime? And so this is that nonlinear response curve. Now notice it's quite different than what we see for mortality. Now we kind of see it more going up. So what we see here is that as temperature goes up, the risk of violent crime goes up to a point, then it kind of starts to decrease. What we think is happening is that it's hot enough to where more people are going inside or staying inside. And then when it gets extreme heat, it goes up again. So why would this be happening? Why would you have higher violent crime during heat? Well, there are a lot of plausible theories. One is that we know that heat impacts people's mood and impulse control. People are more stressed under temperatures, high temperatures. Also, under nice, warmer days, more people are going outside. People spend more time outside, so there's more potential for interaction and potential crime. Now, do I think violent crime from high temperatures is one of the big public health impacts of climate change? I don't, but I do think it's an impact. And I think there are a lot of impacts like this that are not in the conversation that collectively, when we sum them up, mean that the total burden is actually much larger. I want to share some work we did where we did a systematic review and meta-analysis looking at temperature and crime. And this was led by Hyun Michelle Choi, who's a former PhD student of mine. And so we screened over 16,000 studies, and identified 83 that met our inclusion criteria that they're looking at crime in short-term temperature and long-term temperature. And so I just want to highlight some of our results. So here we're seeing many different studies looking at short-term exposure, so that's like over a few days, in relation to assault, and you'll see in the highest blue triangle, that's suggestive evidence. We see effects for homicide, and then long-term is looking more at seasonal changes. Here we have violent crime and property crime, and this is a really important point because for violent crime, we found that for a 10-degree increase in short-term mean temperature, you have a 9% increase in risk of violent crime. 9% increase in risk of violent crime, I think, is pretty substantial. Notice down for property crime below it, we don't see that increase for our meta-analysis. So what we found in our work on crime and heat more broadly, including in this analysis, is that the impact is really on violent crime, not on things like robberies. And this makes sense with the theory of how there are mental changes happening when we are under stress and periods of high temperature. And this is a figure from the Lancet Countdown showing heat and food insecurity. And I just wanted to use this to give another example of an impact that's a less studied health impact from heat. So this is a figure showing you the impacts from heat on a change in people who are experiencing moderate to severe food insecurity. And under conditions of high heat, depending on the region and the agriculture, you could have damage to crops and loss of agricultural product. This could lower people's income. You can have loss of livestock. You can have lower worker productivity on agricultural facilities. And this can lead to food shortages, lower income, higher food costs, and so on. So heat has many impacts from climate change, but it has many impacts beyond those that we kind of typically hear about, such as violent crime, food insecurity. And I'm not talking about mental health and well-being due to time constraints, but that's another big example. There's emerging literature showing very important relationships there as well. So I just want to summarize some of my key points. So we have a growing problem of heat and heat waves under a changing climate, and we have enormous public health burden from extreme heat. We also have burden from cold, and we also have burden from that non-optimal temperature. So for example, that's a day where it's warm, but it's not a heat wave, but it's still warmer than what would be optimal from your health perspective. And we have a lot of benefits from heat wave warning systems, and we and many others have quantified there are real public health benefits from having heat wave warning systems. But we also have trade-offs in terms of, do you want false positives and false negatives, and also the trade-off of how does your population respond given the frequency of heat waves. This relationship between heat and health varies dramatically by location, even large cities within the same country, by subpopulation, such as by race, ethnicity, or socioeconomic position, or sex or age, by urbanicity and rurality, and those patterns of urban and rural in relation to heat are different in different places, and also by green space. And so by green space, I mean just vegetation. So this, I should have defined this earlier, but I mean green parks, green parks, tree-lined streets, and so on. And we have growing evidence for additional health outcomes beyond those that have been traditionally studied, indicating that heat is even more harmful and that climate change is even more harmful. And some of the examples I gave were violent crime, food insecurity, and mental health. And so I want to conclude with this figure. This is a figure from that I really like. It's not my figure, but I want to use it because I think it's trying to highlight how everything is connected. So our health is affected by physical chemical conditions like air pollution, by ecosystems like green space, by social systems like our socioeconomic position, social cohesion, lifestyle factors like nutrition, exercise, smoking, and so on. And so this paper and this figure is trying to show how everything is connected. And I think we really see that with the heat health system, with effects on different populations and so on. But I like to add to this figure that all of this is happening under a changing climate. It's also happening differently for different people, where we have issues of environmental justice, where some people are experiencing dramatically different impacts than others, and that can happen in a variety of different ways. And then there are other things that are happening that I think we should think about in this system. One is we have another trend of unprecedented urbanization across the world. In many parts of the world, we have a trend of growing economic inequality. In many countries, we have an increasingly diverse population with respect to race and ethnicity. And then this is a point that I didn't mention, but just want to mention briefly here, which is I think we need small data. So a lot of analyses that I do and many others are looking at big data, and we should do that. I do it. We should continue to do it. But there are a lot of parts of the world that don't have a lot of data. And I think we need to make sure we have analysis for them as well. So looking at our large multi-city study with over 400 cities, many of the places where the populations are at the highest risk are places we don't have a lot of data. We also, for many parts of the world, have a rapidly aging population. So we have all of these trends happening simultaneously with climate change. And another trend I want to mention is scientific denialism. This is different from scientific literacy. I don't mean do people have education in science. I mean, do people believe scientists? And so in many parts of the world, we have this growing trend as well. I think this is partially related to who is conducting science. So if you look at demographics of scientists, we in no way match the general population. And then finally, we had a pandemic and something like that, those types of conditions make big changes as well. So we have all of these simultaneous trends and factors happening in relation to heat and climate change and human health. But I just wanted to end on a positive note since I've spent, a good 40, 45 minutes describing all these health burdens. And so there are many things that people and communities can do. So this graphic shows some individual level protections that people can take. Air conditioning, which is complex because air conditioning is using energy. So you have to be able to afford to use the air conditioning, and then this is producing emissions. But at some level, it also is providing protection. Support networks, hydration, clothing, affecting activities. But then there are also higher level protections, heat wave action plans and alert systems, cooling centers, check-in systems, green space, built environment issues. But then the number one thing that we could do to address this would be to try to address climate change with reducing emissions of greenhouse gas and using clean energy. So we really I think we need kind of an all hands on deck strategies, multiple strategies, small strategies that add up, big strategies, strategies at different scales, individual to international, to try to address these issues of heat and health. And with that, I want to thank my team and my funding sponsors and thank all of you for spending your time with me today. Thank you so much.
Okay. Thank you very much, Michelle. Well, that was very interesting talk. And I think we have 10 minutes for questions. So if anybody want to ask something, please.
Hi. Yes, I would like to ask a question. Thank you very
Great.
much. It was really interesting. And I would like to ask, so what do you know about the heat waves or the effect of the heat waves related to the learning process and cognitive function of children, for instance, or adults?
Yeah, so that's a very interesting point and another health impact that I think is probably understudied. So I have not done any work on that issue myself and my team, but other people have, and I think there is evidence that heat waves are really important to cognitive issues. I mean, we see that with crime. I mean, there's something happens under periods of extreme heat where we behave differently and we think differently. So I actually think it makes a lot of sense and is very, very consistent with some of the other studies.
Yeah, thank you very much.
I'm sorry I can't add more specifics. It's
That's
a health
okay.
outcome that we haven't looked at.
But thank you. It was really interesting. Thank you very much.
Thank you so much.
There another question for Michelle? Graciela?
Hi, thank you, Michelle. Excellent talk, very comprehensive. But I have a couple of questions that arose during the presentation. And if we think about the warning systems, which I agree have to be implemented more widely, there are issues, right? It's not a heat wave. Warning system because matching the definition, suppose you say 95 percentile and 3 days, consecutive days, and so on, it's much harder than just high temperature warning system, or and then it builds up, perhaps if the city is large as Mexico City, where we are. So when you showed, because you show a continuous mortality increase with temperature, there is no threshold really. So high temperature will lead, no, or is it, if you analyze not heat waves but just temperature, because the figures were just temperature, right? They were not heat waves because you had the cold section also, right? It was just temperature in the x-axis.
Yeah, so that's a really good point. So we can think of heat and heat waves as having related but somewhat different types of health impacts, right? So heat waves is intended to capture the health impact of continuous days of heat. So the first day of a heat wave, your body responds just like a day of high heat. Your body doesn't know it's a heat wave yet, right? It hasn't been exposed. But on the second day of a heat wave, your body is already was exposed to high heat the day before. So a given temperature on day 2 of a heat wave is more harmful than a single day of that same high temperature. All right. And so this issue of heat wave and heat warning systems that you bring up is actually really important of like, do I want to warn for heat waves? Do I want to warn for high temperature days? And also, how does it work through time? And so it's not so much that there's a threshold where up until a point high heat doesn't matter anymore, but there is something related to that for heat waves. So for heat waves, the first day of a heat wave, your body doesn't respond like it's a heat wave because it's not for your body yet. On day 2, now it's more harmful. Day 3, now it's more harmful yet. But it doesn't go on forever. Around roughly day 7, and it varies, it stops getting more harmful for a couple of reasons. One is at that point, people have really started to adapt. Like they're not going outside, they're adapting and so on. And the second is, unfortunately, many people who are going to succumb with a health event such as mortality or hospital admissions have already succumbed. So they've been pulled out of the population. So we know that not all heat waves are created equal. So like a longer heat wave is more harmful, a hotter heat wave is more harmful, but a longer heat wave is more harmful up until a point, and then it stops being harmful. We also know that, and this is something that some cities try to get really complicated with, like a heat wave has a different impact if it's the first heat wave of the season or the last heat wave of the season.
Yes. Yes.
So you can imagine a heat wave warning system that's changing its definition over time. So for example, our work in the United States found that in general, the first heat wave is the most harmful. And as you move throughout the heat wave season, they on average become less harmful. But for India, we found the opposite. Our work suggests that each subsequent heat wave is more harmful. And the most harmful heat wave in India, on average, there was some uncertainty, but in general, this suggests the most harmful heat wave in India is the last one, where the stressors have just been building up. So you have really different patterns of how our health is impacted by the definition of a heat wave. Did that address your question?
Yeah.
Great, thank you.
Estela, go ahead.
Hi, thanks so much. Really cool talk. I've been a fan for a long time, Michelle, so I'm happy to hear you give this talk. I wondered if you've done work with combined exposure. So we know that often high heat is happening, and also ozone levels, for example, are really high on a particular day. I wonder if you and your group have done anything with those two exposures or others like that.
Yeah, so it's a really important point because very often we're exposed to multiple things at the same time. So heat and drought or heat and high pollution. So, tropospheric ozone in particular is very driven. The formation is very driven by heat and sunlight, basically. And so we do see this kind of effect where you have kind of these multiple stressors. So we've done some work on that. I also want to mention Kai Chen, who's a professor here at Yale, who has done a lot of the work on looking at co-exposure. So I think this is a growing area of concern as we have more and more extreme events and have more and more co-exposures. I think this issue is critically important and something we need to look at more. But the basic answer to your question is yes, we find impacts of these co-exposures, whether they be air pollution and heat or other things happening at the same time, like drought and heat is another one.
Thank you. There is another question from Luciana.
Yes, thank you, Michelle. It was a really great talk. I'm in São Paulo, Brazil, and I have two questions. One, if we don't rely on air conditioning, what would be the first best option for adaptation or protection? And the second question would be concerning the warning systems. The warning systems that you and your group have studied, do they give, clear instructions for people? Because what I see sometimes is that the warning systems is like, okay, we are under a heat wave, seek for protection or seek for a colder place. But what does it mean? Where is safe to be? These warning systems are giving, really great instructions to people. Thank you.
Yeah, so those are really really good questions. I'm gonna take them in order. So in terms of like what is the best response other than air conditioning in terms of your health? I don't want to pick just one, and I personally believe we need multiple strategies. So heat or heat wave warning systems, which I'll get to in a minute in your part two of your comment. Social networks, understanding knowledge and so on, cooling centers. I think we need everything to try to help with this. There's no easy quick fix. I do think things like greening of cities have a lot of health benefits even beyond heat, but that is something that a community can do to kind of add some resilience. And what's nice about that, or one of the things that's nice about that, is the greening of a city or of a community means that that community is the one that gets the benefits. So that's something that people can do. Your point about heat wave warning systems is a really excellent one because not all heat or heat wave warning systems are the same, right? So some of them are an alert goes out on, the news, and some of them are very detailed, like here's a cooling center, here's what we want you to do, here's a phone tree where we work through religious organizations and physicians and so on. So there's a huge variety of what they mean. I do think that more work needs to be done in terms of evaluating which types of heat and heat wave systems are working well and which are not. And I think it will depend on population and community. So, for example, there are cities that have, cooling centers, but some of them might be, you know, a couple of miles from some at-risk communities. They're not going to walk a couple of miles to go to a cooling center, even though on paper it looks like it's there, right? So I think that there needs to be information on this in terms of what is working well for different communities, keeping in mind the goal is not just to reach the general population, but to reach everyone, but in particular to make sure we're reaching the at-risk populations. And when I say work on what works well and what doesn't, I mean at an in-depth level in terms of like how what information to convey, how to convey the information. Like, is it a website? Is it a map? Is it an app? And also who conveys the information. So, for example, people are more likely to listen to their physicians than they are to some other sources. So I think we can pull in different communities to try to convey the information. So if you have an at-risk patient as a physician, you can imagine a system where the physician is letting the patient know, here's where you can learn about heat wave warning systems. I want to make sure that you know what to do. That will have a much bigger impact than if they just see it on the news. So I think we need a lot more of that in the future.
Thank you.
Okay, thank you very much. Unfortunately, we've reached the end of the seminar. We are out of time now. So I just want to thank Michelle for a great talk, very interesting. And I want to invite everybody to our next seminar in 1 month. We will have keep talking about the atmosphere and that. So thank you very much, Michelle, and thank you everybody for being here. And
Great. Thank you for the
yeah.
opportunity. Nice to speak with you all.
Thank
Thank
you.
you.
Nice. Bye.
Bye.